Good afternoon, everyone. My name is Mercedes Witowski. I'm the Executive Director at the New Jersey Council on Developmental Disabilities. Thank you for spending time with us today.
I'm not on the camera.
Oh,
I don't do camera.
If you could, if you are attendees,
I'm just there listening.
please mute.
I don't know, maybe it'll say panelist. but it's-
Why do I have?
Sound. Okay. Thank you for spending time with us. It's also terrific to see the growing number of legislative caucus members. I think we're up to 36 now, and supporting organizations. Equally encouraging to have individuals with disabilities and their families viewing today's meeting as attendees. We are offering closed captioning. You can find that at the bottom of your screen. And we do have sign language interpreters who will be spotlighted throughout today's session. Attendees are in listen-only mode, but encouraged to email comments about today's topic and other important topics by visiting the New Jersey Legislative Caucus dedicated webpage. And you should find that link in the chat area. Although chat is disabled, we are encouraging you to send your comments through the caucus webpage. You also can locate on that page the members of the legislature as the caucus members, as well as the supporting organizations, and you can connect with them, sign up for emails, mailing lists, and as I've mentioned, please submit your comments there. This session is being recorded, and you'll be able to view the recording on a dedicated webpage. And for this session, we'll also be sending out additional materials and resources with the recording link. Panelists, please remain on mute so that we have great recording sound. And so we'll get started. The New Jersey Legislative Disability Caucus, as I hope you know now, serves as a bipartisan forum within the legislature for lawmakers and their staff to consider the impact on the disability community when shaping all public policies. And we know that this can be accomplished through increased awareness and a greater understanding of the complexities of the service system and the issues affecting individuals with disabilities. You know, we rely on people with disabilities, their families, and the organizations that serve, support, and advocate for people with disabilities to serve as a resource to this 36-member caucus by providing education and insight into the disability community. As we celebrate the 32nd anniversary of the Americans with Disabilities Act and Disability Pride Month in July, I'm delighted to now introduce two of the four co-chairs of the caucus. Senator Bucco and Assemblywoman Dunn have personal family experience with disabilities and are incredibly strong supporters of disability issues. They have a solid track record of listening and supporting legislation in reaction to issues that they learn from you, their constituents. Again, we're grateful that they are co-chairing today's session, and I will ask Senate Majority Leader Anthony Bucco, serving District 25, to open today's session. Thank you.
Thank you, Mercedes. It is certainly an honor to serve as one of the co-chairs in the Senate. Today's topic that we're going to discuss is direct support professionals and the workforce crisis that we have seen, not only here in the state, but nationwide, and to hopefully come up with some solutions to develop a sustainable workforce. This topic, I think, is long overdue, and I am glad that today we'll have an opportunity to spend an hour going over and listening to some of the experts in this area to hopefully get us to a point where we can come up with some resolution to this crisis. You know, we're all aware of the ongoing employment crisis. We see it every day. Help wanted signs in restaurants and other parts of our economy. But when it comes to direct support professionals who care for some of our most vulnerable individuals with developmental or intellectual disabilities or illnesses, it becomes even more problematic. It impacts their daily lives. Even the simplest of activities that cannot be handled. It's a loss of a problem solver for those folks, a loss of an advocate. And that's critical, that we look at this crisis and we come up with some solution. We as a state have an obligation to make sure that those most vulnerable get the care that they need and deserve. And the shortage of the DSPs has become a national problem, as I said, and has been decades in the making. The pandemic may have affected our economy recently, but it has certainly exacerbated the problem for DSPs to a full-blown crisis. A recent survey found that virtually all direct support agencies report difficulties in recruiting and retention. 77% are turning away new referrals. 1/2 are discontinuing programs and services. That's unacceptable. This year, New Jersey is listed 24th as the best state for a DSP to live and work. We can certainly do better here in New Jersey. And while we won't be able to solve this crisis in an hour-long hearing, we can certainly raise awareness and explore areas to help address this growing problem. Areas like making the job more attractive, including a better wage. In January, DSPs will see their 4th hourly rate increase since 2019, bringing the current median wage to $17.86 per hour. But that is simply not enough. Folks need to see it more than a job, but as a career. Marketing the DSP position as a career opportunity with advancement certainly needs to be a priority. Implementing the use of technology to become more efficient and effective. Everyone has a handheld device nowadays. We need to capitalize on the technology that we have. We need to connect team care units. We need to promote telehealth strategies and remote monitoring. This will make it easier for our DSPs and provide better patient care. My colleague who I saw sign on to the caucus, Senator Corrado, sponsors Bill S-53 to establish a task force to explore these areas and issue a report back to the governor and the legislature. We need to move this legislation. Recruitment needs to become a priority. Our county colleges can certainly play a role in this area, just like they have with the STEM manufacturing industry. For years, folks stayed away from that industry because it didn't seem appealing. But through promotion, through the county college, through marketing, they've now made that a career path. We need to do the same thing for DSPs. The county colleges certainly are a place where that can occur. These are just a few areas we need to explore. There are many, many more. I look forward to a great discussion today and working with my fellow members of the caucus to provide legislation to address this growing crisis. Thank you, Mercedes, and I look forward to the coming discussion.
Thank you, Senator Bucco. You bring very wise remarks to our discussion. And now I'd like to introduce co-chair Assemblywoman Ora Dunn, also proudly serving District 25. Assemblywoman.
That's right. Thank you so much. I couldn't be more pleased to co-lead this month's meeting with my district mate and Senator Anthony Bucco. And I want to thank all the stakeholders that joined us from around the state we know when it comes to advocating for our most vulnerable population, there's no such thing as summer vacation. So thank you all for joining us. And also Mercedes, Libby, Gary, Jacinta, all of you, you're helping us stay organized, focused, and really to run a solutions-oriented meeting, which we know, we only have an hour to discuss the critical need of the workforce shortage. So we're not gonna be able to solve it in that hour, but hopefully we do leave this meeting with some real practicable steps, sorry about that, to alleviate the pressures that so many of these agencies are facing. And while placement waiting lists continue to pile up. And as Mercedes shared, I come to you and join this meeting, honored to do so, not just as a policymaker, and I'm here with my colleagues to listen to how we can create those tools and come up with those ideas, because you as the experts, but also as the sister of a disabled adult who's lived in a group home for a little over 5 years now. And I really, we've lived through COVID, the visitation restrictions. So I've really been able to witness and experience firsthand these challenges, even to the point where needing to fill in. So a care manager could find out who's going to fill in for the next shift for the two providers that weren't able to show up. And we're seeing that constantly, that a lot of the direct service providers are working 2, even sometimes 3 shifts in a row. And then with the lower staff resident or staff client ratio, we see that, safety risks increase. So in this context, and I know we'll talk about the attractiveness of the higher wages that can be offered in the outside, in the retail sector, jobs that guarantee a start and end to your shift, and lower stressors in that environment. We know that we're up against that in terms of making this an appealing career choice. I liken it to, I think our responsibility is to expose the younger generation behind us, the future workforce generation, and really expand awareness that it's more vocation than occupation. And there are so many intrinsic rewards that I think what we as a society have to do a better job at communicating and valuing. So I do see it rooted in education. I know that we took a really important step in this last budget. So in fiscal year 2023, there's a new program. We created the New Jersey Community College Consortium for Workforce and Development, which was appropriated $1 million to support direct service professionals. And I really look forward to hearing from all of you on your thoughts on that and how we can really get that program up and running so we can really address this issue. So with that, I just want to thank all of you again and looking forward to a very productive and successful meeting.
Thank you, Assemblywoman Dunn. You're right, we do not take a break, even though it's July. Many staff provide 24-hour supervision. So we work in this space around the clock, 24 hours a day, 7 days a week. Holidays and summers don't slow down this work and actually make it even more important. So I think we also have consensus that we will never solve this crisis in an hour, but we would like to add some perspective, gain some greater awareness, and offer solutions for the remainder of this hour. It's important to distinguish that when we speak about direct care workers, we may use different terms like direct support professional or DSPs, home health aides, personal care assistants, self-directed employees, self-hires, support staff, and other titles like that. And while there are different funding mechanisms across programs and services, we're basically referring to the worker who provides support to someone with a disability to get out of bed, to get dressed, to go to work or school, to take care of all the tasks like cooking, cleaning, shopping, teaching independent living skills, and the list goes on. But consider a direct care worker for this discussion as someone who you or your loved one needs when you are not able to do something without a level of assistance. And we are broadly talking about workers who support people in their own homes, in group homes, and other out-of-home settings, in nursing facilities, in day and adult day centers and rehab centers. So in planning today's agenda, as you've already heard, we've worked closely with Senator Bucco and Assemblywoman Dunn to identify those few focus areas. So we want to bring you a personal advocate's perspective, raise awareness of national and New Jersey challenges, data, and hear about some of what's being done and other steps that can be taken for incremental change, so that we can see some positive change occur in addressing the recruitment, retention, turnover issues, and alleviate some of the pressures creating that direct worker shortage. Other important areas, could be raised, but we won't have time. There is some national research data that we will make available to you with today's recording. I just want to take a few minutes to bring you the latest research, research that was just released today from United for ALICE. United for ALICE is a driver of research, innovation, and action to improve life across the country for ALICE. And you may be saying, what is ALICE? Well, ALICE began their work right here at the United Way of Northern New Jersey. And so you may be thinking, who is ALICE? ALICE stands for Asset Limited, Income Constrained, Employed. Those identified as ALICE are workers who earn just above the federal poverty level, but less than what it costs to live to make ends meet. These workers and their families are forced into making impossible choices every day. And we're fortunate that today, in the release of ALICE in Focus and drilling down within that report, is a focus on people with disabilities. The top level finding of that report tells us that traditional measures of poverty have severely undercounted the number of people with disabilities who experience financial hardship in New Jersey and nationwide. And that the number of people with disabilities, often tells us a familiar but very uncomfortable story. According to the federal poverty level, 14% of people with disabilities in New Jersey were struggling in 2019, just before the pandemic hit. But the ALICE now measures that another 33% could not afford a basic household budget of the costs like housing, food, transportation, etc. This report has so many data points for you to review, and we will share the report and a brief, a one-page brief after today's meeting with the post-event materials. But directly tied to our topic today, direct care workers are also often ALICE counted. The report found 36% of home health aides and 45% of personal care aides were below the ALICE threshold. In addition, many home health aides and personal care aides have a disability themselves. So great data, but hands down, we know that wages are a huge factor in a quality workforce for people with disabilities. We have to pay a wage that recognizes the critical work provided and the skill sets that are needed. We cannot expect quality services that help people with disabilities to achieve the quality lives that they deserve if we don't invest in the wages and the competency-based training of the worker who provides supports. Please note that every worker in New Jersey appreciates the recognition of New Jersey's minimum wage increases and how that has impacted wages on the direct care worker, and those incremental increases to the workers to help keep pace with minimum wage. But we really need to do more. The data tells us that even with recent increases, 1/3 to almost half of the workers are earning wages below the federal poverty level. To add some perspective, since most of us don't associate our wages with an hourly dollar amount, direct care workers are earning somewhere between $30,000 and $35,000 per year. I think it's easier to do the math and think about the wages of a direct care worker when we think in terms of annual pay before taxes, $30,000 to $35,000 a year. These direct care workers are the lifeline to so many people with disabilities. We can have all the incredible programs and program descriptions and program offerings, but if we cannot recruit and retain workers, unfortunately, we don't have a system. We don't have services without workers to perform them. Provider agencies don't bill and cannot bill for services if they don't have workers to provide the services. Day programs remain closed or partially open, and many other community-based organizations are not operating at capacity. So we also cannot put people with disabilities in the position of making the difficult decisions. And we've talked to those people who need to choose between getting out of bed in the morning or eating dinner in the evening, because there aren't workers for both of those critical service needs in a person's day. People with disabilities make life-risking decisions, and they've made them this morning, and they'll unfortunately make them tomorrow morning because of the limited workers in our pool. So we must provide that lifeline on this really disproportionate crisis and come up with solutions wherever we can. So to kick us off, I'd like to invite and introduce you to Marlene Brockington. Marlene is a self-advocate and a recent graduate of the New Jersey's Partner in Policymaking program. Welcome, Marlene.
Thank you for having me. Hi, everyone. My name is Marlene Brockington. I live in my own apartment in Lawrence, New Jersey. I would like to thank Senator Bucco and Assemblywoman Dunn and all the other members of the Legislative Disability Caucus for today's topic of direct worker crisis. I'm an advocate, a graduate of New Jersey Partners in Policymaking, a student at Rider University, and a friend. Because of all the different facets in my life, I'm very active in my community, but I would not be able to be as active without all the support that I have. My support consists of 2 home health aides, 3 DSPs, and my dad. All of these people help me lead the life that I want to live. I have cerebral palsy and completely rely on direct care workers and would not be able to get up and do the things that are important to me without my strong team of staff. My services come from different programs in New Jersey. Having DSPs are especially important because I only get 40 hours from my home health aides. My home health aides assist me with daily living needs, cooking, bathing, and cleaning. There's so much more required to make a person's life worthwhile. Without additional help from my DSPs, I'm not living, I'm existing. DSPs are important because they not only do what you need, but they do what you want. They help me in school, help me come up with new recipes, help me organize things the way that I want, and help me come up with activities for my friends. because I rely on my support staff for all of my needs. When one person is not able to come, it affects my whole day. If a person does not show up, I do not get out of bed, I do not eat, I do not go to my classes. Direct support people are not a luxury, they are a necessity. Direct support people not only make life, but they make sure you get the most out of life. Thank you.
Thank you, Marlene. Thank you for sharing about your life with us. I also want to, if you would please thank your dad for being one of those 43.5 million unpaid caregivers in the United States. Because I know that when we talked, you shared that you really rely on him, that if a DSP doesn't get to you, that you've got to call him. And so tell him we said thank you.
I sure will.
And good luck with your upcoming college schedule. We wish you all the best. Thank you for joining us this morning. And I know you're going to stay on in case there's some more to talk about.
Yes, I will.
Thank you, Marlene. So let me now introduce to you, Marlene brings you that personal story, but let me introduce to you someone who brings you a very larger picture. Joseph Macbeth. Joe Macbeth is the Chief Executive Officer and President of the National Alliance of Direct Support Professionals. That's NADSP for short. And he's worked in the field of IDD for 40 years, beginning as a direct support professional. Joe, you and I can shake hands on that. We got the same credentials there. He's recognized as an international leader in the advocacy and movement to recognize DSPs as a profession. He's built a robust membership of service organizations representing nearly 60,000 DSPs, partnered with other national organizations to influence public policy reform, and created the first national certification program using a digital badge platform called eBadge Academy, which has won national recognition. Most recently, Joe has been appointed by President Joe Biden to the President's Committee for Intellectual Disabilities, PCPID, for a 2-year term. And we are delighted, Joe, that you'll serve with New Jersey's own Paul Aronson over the next 2 years. So Joe, we're here for you and ready to listen to the national scene.
Well, thank you, Mercedes, and good afternoon, everybody. Thanks for this invitation to speak with you today, and happy 32nd birthday to the Americans with Disabilities Act. As Mercedes mentioned in my intro, I'm the president and CEO of the National Alliance for Direct Support Professionals that was founded in 1996 by the late John F. Kennedy Jr., and the only national advocacy organization whose sole purpose is dedicated to advancing the direct support profession. In 1996, John Kennedy wrote in a report to the president that quality is defined at the point of interaction between the staff member and the individual with a disability. For more than 25 years, our mission at the NADSP has been to enhance the quality of support provided to people with disabilities through the provision of products and services and certifications that elevate the status of direct support workers, improve their practice standards, promote systems reform, and most importantly, advance their knowledge, skills, and values. We do not stray from this mission. So what exactly does quality at the point of interaction mean to those of you outside of our disability circles? Well, every industry, whether it be manufacturing or technology or finance or sales or healthcare or supporting people with disabilities, have a benchmark for quality. In our work, we measure quality in the terms of what we call valued outcomes. helping people with disabilities achieve things that are important to them. Big things like finding and keeping employment, helping people develop meaningful and productive relationships, helping people live in their own homes, helping people stay connected and included in their communities, or helping people stay out of institutional settings. Outcomes can also be small things like preparing a meal or dressing oneself or balancing a checkbook. As we've seen over the past 2.5 years, these outcomes can also be a matter of life and death, like keeping people healthy and safe during a worldwide pandemic and free from a virus that is 3 times more likely to cause death for people with disabilities and advanced age due to pre-existing conditions. So you might say that direct support professionals are the Jack and Jills of all trades, and they do it all, and that would be true. And by the way, these outcomes that we talk about, that we define quality, they're never accidental. They don't happen magically. When you analyze these outcomes and when you deconstruct these outcomes, when you look under the hood of these outcomes, you will most often find a direct support professional, or more likely a team of direct support professionals who are highly intentional in their practice and can objectively demonstrate the correlation between their knowledge, skills, and values with the outcomes. Quality rests on the shoulders of this direct support workforce, and to say that they are the backbone of this system is not an understatement. For decades, there's been a perception across this country that direct support work is unskilled work, entry-level work, a job that just anybody can do. And I can assure you that after 40 years of working with direct support professionals in many service sectors, including IDD and aging and behavioral health and at-risk youth, nothing can be further from the truth. The work of a direct support professional is challenging, it's complex, it's continually changing. No day at work is ever the same. It requires high levels of acuity, responsibility, judgment, and character. I would argue that the false perception around this work is why we find ourselves at this cliff's edge, where a critical shortage of direct care workers, qualified workers, is leading to service programs closing, people and families being unserved, highly vulnerable people at significant risk of abuse, neglect, and exploitation. And we can't blame the pandemic. In fact, in my very strong opinion, COVID-19 has merely lifted a veil and has exposed our service system's weakest link, the direct care workforce. And make no mistake, this is not a crisis. A crisis is sudden, unexpected, and temporary. We knew that this day was coming more than 25 years ago, and we as a system failed to address it. Yet we continue to collect data and share data about poverty level wages, inadequate training, absence of career ladders, and a lack of professional identity, and a lack of professional respect. The critical shortage of our direct support workforce is well documented. And if there's a silver lining to this dreadful pandemic, it might just be that the highest levels of government are now beginning to take notice of just how essential direct care workers are, and infusing the system with much needed financial resources to address this shortage. Let's not squander this opportunity. Let's do it right. Let's make careful and deliberate investments that can address this system in the long term. If you survey a direct care worker and ask them, what's the most important thing that we can do to support you? I believe the overwhelming answer would be, give us a living wage. A wage where I don't have to work 2 or 3 jobs to support my family. There are a lot of reports on wages. In fact, the Ombudsman for individuals with intellectual and developmental disabilities and their families for the state of New Jersey has highlighted workforce issues in each of their annual reports. Most recently, in the 2021 report, they reveal a really disturbing truth, that wages and salaries are the same regardless of the level of care a person requires. And we know that low wages feeds high turnover, And we see a revolving door of strangers supporting people, oftentimes with the most intimate of care. Year after year after year, we see half of this workforce leave. And that costs your state millions of taxpayers' dollars in turnover. So to be sure, this is to solve this complex issue, and it is very much a complex issue, will require comprehensive solutions. There's no one solution. Wages alone is not going to solve this issue. There's no silver bullet here. But I have a couple of ideas and suggestions, and I would love to come back to meet with you and spend more time than this 7 minutes that I'm spending with you today. So here's a couple of bullets that I came up with. Introduce legislation that provides a living wage to recruit new workers, but at the same time, please do not forget the tenured incumbent workers. There's a wage compression happening when we increase the starting level salaries and don't address the salaries of tenured workers. You're going to lose them, and they are your most important resource. To reduce turnover, create rate-setting methodologies with values-based payments that incentivize career ladders that lead to voluntary credentialing for tenured direct care workers. We must keep high-performing direct care workers in the jobs that they excel in and enjoy, rather than promoting them into a completely different job with completely different skill sets. Keep those high-performing DSPs in those jobs and pay them as they demonstrate higher skills. Encourage your members of Congress and your United States senators to sponsor H.R. 4779 and Senate Resolution 1437, called the Recognizing the Role of Direct Support Professionals Act, that would require the Office of Management and Budget to establish a separate category within the standard occupational classification system for direct support professionals so that we can begin to collect more reliable data and prevent direct support professionals from being anonymous. And lastly, and not least, we helped co-author the report to the president in 2017. For the President's Committee for People with Intellectual Disabilities. And we've shared it with you. I've shared it with Mercedes. You'll get it later. But in this report, we've identified 9 solid recommendations to address the workforce shortage 5 years ago. And I'm sad and frustrated that none of the report's findings have been implemented. We know what needs to be done. It's up to policymakers and elected officials like you to have the will to do it. And we, as an advocacy organization that's steeped in rich history in public policy, are eager and hopeful to work with you. So with that, Mercedes, thank you so much for having me today, and I'll stick around.
Well, yeah, don't go too far, Joe. We are so delighted and honored to have you join this this important discussion today. And I'm going to, pause and ask Senator Bucco, Assemblywoman Dunn, if you have anything, directly to share or ask Joe and any other members of the caucus, so that we can take advantage of a minute or two of Joe's time right now. And appreciate your offer to come back.
Thank you, Mercedes. I would certainly like to receive a copy of that report. And I would like to, if you could highlight for me those 9 recommendations that were made, I would appreciate that.
Senator, I don't have the 9 recommendations memorized, but I can tell you that a few of them were in some of the things that I mentioned: creating career ladders and certifications for DSPs that are attached to not just bonuses, but hourly incremental wage increases as they demonstrate higher levels of skill, using technology to support DSPs in their work, so we may not have to rely on so many of them, and getting direct support professionals more comfortable in using technology, in helping people with disabilities become more included and vital parts of their community. We need to establish that professional identity that is recognizable in the Bureau of Labor Statistics, so we have reliable data about the numbers of DSPs and how many we're going to need to meet future needs. We are going to also use that data so we can improve rate setting methodologies. When states look at setting rates for the provider community, they are required to use a job classification title that's recognized by the Bureau of Labor Statistics. There is not a job title called direct support professional that's identified in BLS. So they're using home health aides, personal care attendants, and other job titles that are similar and share some similar basic competency areas as the direct support professional. But the reality is, all of these caregiving jobs are important, but they are not all the same. The job of direct support professional they're doing things in many states that LPNs can't do. So when we use other job titles, we are seeing rates being set that do not adequately represent the work that direct support professionals do. That's a national issue that can only be resolved at the national level. But when the feds do that, it will trickle down to the states. So getting that professional identity, career ladders, living wages, the use of technology, finding ways to attract younger workers. This is an aging workforce. The median age of this workforce is like 37 years old. And we have to attract new workers, early retirees, men, veterans, people with disabilities should be able to become a direct support professional. So there's a lot of opportunity here, and I will assure you that we'll send you that report.
Thank you. I appreciate that.
Of course.
Assemblywoman Dunn, did you have something to share?
Yeah, and I just want to say thank you. This is really enlightening. I really appreciate your participation in this meeting. I too, of course, would love to see that report. The fact that you said it was issued 5 years ago and haven't seen them implemented is frustrating for me. I can't even imagine for you when this is your life's work. So I also would love to understand how New Jersey fits into that, right? I'm hoping at some point we're doing better than other states. We've implemented some of the 9, but I know it's no secret that New Jersey is known for a sluggish and very cumbersome licensing and certification process. Which is really a huge barrier to growing that workforce. So I would love to delve into that as well. So I look forward to seeing that report. And again, thank you.
Yeah, thank you, Assemblywoman. I can tell you that if it's any consolation, New Jersey is faring pretty well in regard to other states. According to the staff stability report that is done through the National Core Indicators, your vacancy rate in this workforce is around 11%, which is low compared to other states. Your turnover rates, according to the NCI data, is about 34%, which is lower than the national average of around 49%. So you're doing something right here. You're off to a good start. You've got a head start in relation to other states. Your average salary, according to NCI, is about $16.06 an hour, which is $34,500 a year before taxes. That's still a low wage when you take a look at the responsibilities that you're required to do in relationship to other industries. And I don't mean to demean fast food or retail or anything like that. Great jobs, important work. But the level of accountability and responsibility associated with this work is really no comparison.
Thank you. If I could just add also, we can benefit from being one of the most populous states, right? We also have a high cost of living, so we've got to factor all that in. But your point about diversifying the workforce is so critical. So I'm not sure if that's one of the recommendations on how we can do that, but I know that you talked about the definition of quality is at the point of interaction. And we know that having a more diversified workforce, it comes down to relationship with the residents, with clients, and often, I see, the benefit of having more men in the field as well, where the clients respond, with right at that relationship point. So thank you for bringing that up.
Thank you.
Great conversation. Thank you so much. Thank you again, Joe, and we will be back in touch. And I know you're going to stick around. We do have two more speakers that I'd like to move forward and introduce. Next up, please help me welcome this, what I'll call our tag team speakers, who will focus on some of the current practices and initiatives to strengthen the direct worker crisis. And Joe says it's not a crisis. Yes, you're right, Joe. Val Sellers, she's the Chief Executive Officer at the New Jersey Association of Community Providers. And prior to that, Val had vast experience in healthcare planning and research. And Aaron Fitchner, he's President of New Jersey Council of County Colleges. And just before taking that position, he was the Commissioner at the New Jersey Department of Labor and Workforce Development. Val and Aaron are passionate about their work and the impact the direct care workers have on this state's most vulnerable citizens. Welcome, and I think Val will start us off.
Actually, Mercedes, I'm going to let Aaron start
I
because
think Aaron's going to start us off.
Yeah. And I'll show the tie-in between the
Great.
two of us.
Thanks, guys.
Well, thanks, Val, and thank you so much, Mercedes. Thank you, Senator Bucco, Assemblywoman Dunn, and all the members of this important caucus. I'm joining you today actually from County College of Morris, located in Assemblywoman Dunn and Senator Bucco's district. So it's a pleasure to be here from one of our 18 community colleges. And as Assemblywoman Dunn noted, legislation was passed and budget item appropriated, providing $1 million for a pilot effort run by the Community College Consortium for Workforce and Economic Development, which is an arm of our Council of County Colleges. And we are proud to be working with Val and her team to really put the meat on the bones of this really important effort, and then to work with the Office of the Secretary of Higher Education to get the program up and running, we hope, in the fall. The program has a number of really important components that I think very much dovetail to what we've heard from Marlene, from Mercedes, and from Joe, and I think could be part of a broader solution that allows us to help attract and support and retain more people for this really critical occupation. So the three important components, and Val, please elaborate from the perspective of the provider community. The first, as Joe said, we need to do a better job of recruiting more diverse populations and individuals to pursue this very important and rewarding career. And so a cornerstone of this initiative is to work with our colleges and with local high schools to develop programs that can help prepare both young people who are looking for career opportunities while they're in high school, as they make career choices for their post-high school years, as well as individuals who are unemployed and underemployed and working to find employment. And so we will be working collaboratively to recruit more individuals to obtain training that will help them get on a path to a job as a DSP. So that's the number one part of the pilot effort. Number two is there are very stringent and important requirements for training for people who are DSPs. Val can talk more about that. It is critically important for us that those programs can become part of that career pathway that we've talked about already in today's discussion, that there is a clear path from that training to the opportunity for an individual to get college credit and be able to come to a community college to earn additional credentials and associate's degrees that will help them move up the career ladder in ways very similar to what Joe is talking about. And that is the third most important final piece, is that if we are going to retain more individuals who are DSPs, we need to help them get the education, the training, the credentials to stay in the field. And perhaps some of them may stay in the field for some time and transition to other occupations, whether in social work or in healthcare, other occupations. We have a real opportunity with our very generous state and federal financial aid programs to help DSPs come to a community college and get courses that will help them stay working as a DSP, learn new skills, obtain new credentials, and ultimately attain associate's degrees that will help them be more effective as DSPs, or to choose to move on to other occupational opportunities. So New Jersey's 18 community colleges are very proud to be working on this very important issue. And Val, I will turn it over to you for the perspective from you and your organization.
Thank you, Aaron. And I have to say, I was very fortunate in that Aaron and I had a bill for 3 years that I was trying to move. And Aaron and I came together and he supported the initiative, which establishes a DSP career development program. And essentially what it is, it's an office solely for DSPs, and it's to assist DSPs in pursuing education, as Aaron said, starting with the community colleges. But we're not limiting it to current DSPs. We're also going into the high schools. We're going to go to unemployment offices. I mean, there are a number of places that we believe we can recruit from, but it's the responsibility of the director of this program to reach out to all these different sites and see if there is interest in pursuing a career as a direct support professional. And to Aaron's point, I think, our hope is that they will pursue education. It will help with retention, recruitment and retention. And I think it can be a daunting process. If you're not familiar with it, it helps to have somebody that's going to walk you through the process. And having a relationship with Aaron and the county colleges, I think, only serves the director's goal of reaching out. And so working together, we can't offer $24 an hour. I'd love to do that, but given the finances, we have to find other ways to attract individuals into this field. And right now, I know Joe shared some statistics, but we're not attracting the best and brightest into the field. And they come in and within a month or two, they leave because they don't really understand the requirements of the job. It's daunting. So we have to find other means by which we can bring people into this field. There's also another program that we're looking at, aside from this, Aaron, is a federal student loan program, forgiveness program. So we're hoping that between the DSP Career Center and a federal student loan forgiveness program, that will serve as an enticement to bring people into our field. And I think it just goes hand in glove with training and that all DSPs have to go through, and then the voluntary credentialing program that's being developed as currently, I believe. And then Aaron and I have even talked about maybe we develop a curriculum for this field. That's down the road, but I think, I didn't think we'd get here and we're here. So I'm hoping that once we get the program up and running, then we can start to explore, is this a career path that individuals might be interested in pursuing?
Thank you, Val. Thank you, Aaron. Great perspectives. I knew you guys would be right on the money. You've talked about what we can do, what we're doing practically now, and how that can be built upon. I want to make sure that I also mention we have 2 other co-chairs of our caucus. We have Senator Ruiz and Assemblyman Greenwald. Assemblyman Greenwald has his hand up. He's been very patient, waiting for an opportunity. So I'm going to let him go, and then we're going to get back into a little bit more of that conversation. Assemblyman Greenwald.
No, Mercedes, thank you. I kind of I really agree with Aura's comments, and Val, I think, just took some of the thoughts I had when I raised my hand in response to some of the issues that Joe raised. I'm appreciative that Joe has acknowledged that New Jersey seems to be doing something right. But I think the challenge, we all know this challenge, right? And Val, I think, said it well. We're attracting a certain group of people into this profession that they don't know what, and let me apologize. I don't know that we are always using the right words as elected officials in this. So, I'm taking this from layman's speak. So I apologize, but that's one of the reasons we set up this caucus. And it's very helpful for us and for the members. And before I forget, Joe, I think it would be helpful for all of us if you sent that report to every member on the committee. I know Senator Ruiz, myself, all the members, I think, would benefit from having the report so we can review it to see what we would tackle next. But, to me, if there is a way, and I think this is what Val was alluding to, and again, I'm going to speak in layman's terms. If there is a way to use the DSP as an entry level where we were bringing them in, and yes, they're starting, I think one of you mentioned it comes out to about $34,000 a year. But if it was a career path through educational resources, or as Val pointed out, maybe a path to nursing, if we had turnover at the DSP level, but we were creating a pipeline because people looked at it as an entry-level position to raise their standing in the profession, as well as to create an economic opportunity for them and their family. I think that, and maybe we're doing that already, I think that's where Val was headed. But to really almost promote it and advocate it that way, and to use our friends like Aaron in the county college community through the 21 counties in the state to identify this as a career path in healthcare, which is one of our strongest industries in the state, and to show upward mobility within the profession, I think you would have a churn, but it would be a positive churn for people that would want to come in at an entry-level position to who may have to work while they're going to school, who may need income coming in, who may look at this as a different career path than typical high school, college, but an opportunity to build a path up through management in this field. I think that would be interesting. And I think the members in a bipartisan fashion would be intrigued to work on that. So Mercedes, that was really listening to Joe. That's what triggered in my mind. And then kind of hearing Val and Aaron kind of reference around that. Those were my thoughts.
That's terrific. I'm glad that that helped bring about those thoughts, because that's the conversation, like you said, that we need to have in these sessions.
Yeah, and Mercedes, we've promoted loan forgiveness programs at the state, right? So, and obviously we've worked very closely with all of you on certain policy initiatives, but maybe we're approaching it from the outside in, where if we could really direct this as almost an identifiable educational paradigm that people could come in at this level and build a career, that might be an interesting approach to take. And we could offer that through the county colleges, or start at the county colleges and then advance it through the 4 years. It would be an interesting opportunity.
Absolutely. Yeah, absolutely. Thank you so much. We need to consider the other ways to attract workers into this work pool. And that certainly is a path that we can more broadly explore. And Val and Aaron, you're going to be on the hot seat for that one, helping bring more clarity and mechanisms to make that happen. Any response on that?
Yeah, I would just say Mercedes and Assemblyman Greenwald, thank you. I think you put it more eloquently than Val and I did. That is the vision here. We need to build those career pathways that allow people to pursue a career as a DSP and continue to move up as a stepping stone to perhaps other careers as well. And so that is what Val and I are committed to doing with our partners with the Secretary's office. And thank you, Assemblyman, for your support of the Community College Opportunity Grant Program. That will be a game changer for many DSPs, allowing them to go to a community college tuition free now. So thanks to your leadership and others in the legislature. So yes, that is exactly the vision. Look forward to working with you and others to make that a reality.
That's great.
Thank you.
And we also know that not everyone is looking for this field to be a career track to to move up, to advance. So where we also can work at looking at other benefits and a menu of other available subsidies, like childcare discounts, food, housing, utility assistance, where I've met many workers who they want this to be their lifelong job, but they just can't afford at the compression that we talked about earlier, or just the wage that they're being paid. So what other ways? New Jersey is a great state. What other ways can we look at this profession and say, maybe there's other available benefits, of a menu of benefits that we can invest in this workforce, to have a viable workforce, to make to ensure that people with disabilities live the life that Marlene described, have an ability for a quality life. So I'll put that on the table as well. We are coming to that last minute. We do have another session. This is a great conversation. I wish we had more time. I feel like I'm speed dating here. But we do have another session, October 25th, that will feature education with Senator Ruiz, your co-chair, moderating that session. Any last words, Senator Bucco, Assemblywoman Dunn?
I would just like to say that this session was wonderful. I think in my opening comments, when I talked about bringing the county colleges in line, are exactly where we need to go. You know, we saw this in the manufacturing sector where we couldn't find folks to fill those jobs. We were able to market it, retool the county colleges, and now those jobs are filled and people are coming into the colleges for those programs. I think we can do the same thing for this to make it a career path. What I've heard about developing a curriculum, I think, is essential to establish that at the county college level. And I think if we do that and we throw some incentives in there, I think this is something that definitely is doable and will definitely address this problem long into the future. And we could lead the nation in this area. So I look forward to working with my other colleagues in this caucus to make that happen.
Assemblywoman? Just unmute there first.
In my introductory remarks, I put it out there and said, let's have am I still
You're
muted?
good. You're good.
Good.
Okay. So what I just want to say, we put it out there. We called for a productive and successful meeting, leaving with, you know, real ideas. So I'm real happy with that. I know we have to continue the discussion. And I like that idea of leading the nation. I like that. So I really want to dig in and see where we stand on those recommendations, kind of give us a report card, if you will. And so just look forward to our continued work. And thank you so much for this discussion.
Thank you. Thank you, all the speakers. Thank you, Senator Bucco. Thank you, Assemblywoman Dunn. Have a good rest of your day.
Thank you, everybody. Thanks for having us.
Bye.